Usapang kalusugan sa Health Check Plus. Alamin ang mga payong medikal mula sa mga totoong eksperto. Ang kaalaman ay kapangyarihan. Usapang kalusugan sa Health Check Plus.
Magandang araw Pilipinas, Luzon, Visayas, Mindanao at Sulu. Magandang araw sa lahat ng nakikinig at nanonood sa DZRH Radio at Digital TV sa buong mundo. Ako po si Attorney Mimi Campos Banayat. Samahan ninyo po ako sa isang oras na talakayan kasama ang mga eksperto sa kalusugan, kagalingan at kagandahan dito sa Health Check Plus. Bago tayo magsimula, shout out sa Shell Foundation, Manila Broadcasting Company at ang Scintilla Iuris Astroncientis Stella Iuris COVID-19 Action Network sa kanilang pamamahagi ng We Care Pack sa ating frontliners sa East Avenue Medical Center noong Friday. Ang pasasalamat sa frontliners ay proyekto gaganapin sa Siampang Ospital sa Metro Manila. Mabuhay po kayo. Ang pag-uusapan po natin yan ay isang mahalagang issue na naisang tabi dahil sa pandemya. Pero ito ay nararamdaman natin ng gusto tuwing sobrang init ng araw at tuwing panahon ng bagyo. Ito po ang climate change o pagbabago ng klima dahil sa carbon dioxide emissions na nagmumula sa paggamit ng coal, gas at oil para sa enerhiya at iba pang gawain sa ating. Tayo po ay mapalat ngayon at nabigyan ng pagkakataon para makausap ang isang ekspertong alam ang napakatinding climate change sa kalusugan at natin at ng komunidad natin sa buong mundo. Siya po si Dr. Monica Rull, Medical Director ng Medicines Frontiers o Doctors Without Borders na nakabase sa Geneva, Switzerland. Dahil hindi po marunong ng Pilipino si Dr. Monica Rull, usapang English po tayo ngayong araw. Good day, Dr. Rull, and welcome to Health Check Plus. Before we begin, Dr. Rull, can you briefly tell us about Doctors Without Borders and what you do as a medical doctor?
Yeah, well, so as a medical director, I run a department that provides technical support to our medical operations in the field. So that is composed with medical expertise, but as well with pharmacy and with health promotion. We are launching as well a program on patient and population as partners, so integrating the view of the affected individuals and communities. And recently we added into our pool planetary health advisor as to move on with health consequences of environmental and animal health.
According to a major UN report, global warming will get progressively worse and cannot be stopped over the next 30 years because of the failure to curb emission goals agreed upon in the Paris Conference. It is said we only have a short window to stop the situation from getting worse. The MSF operates worldwide in areas where there is war, armed conflict, disasters, and where disease is rampant and healthcare services are inadequate, if not unavailable. In what ways has MSF seen climate change affect public health?
I don't know if you are aware of the planetary health approach. It's englobing all what is human health, animal health, and the environmental health. So it's the approach that there cannot be health for human beings if there is no health for the environment we live on. We are trying to merge the medical with the non-medical environment, climate change, biodiversity loss, degradation of the environment, and the zoonotic diseases that we are seeing more and more facing up.
You mentioned that you're considering hotspots of the effects of climate change and public health on public health. Would you consider the Philippines as a hotspot, Monica?
Well, not me who considers the Filipinos hotspots. We are working in what the scientific community has identified as risk areas where they are very exposed to climate change consequences. And yes, the Philippines is one of the areas that is exposed because as we mentioned before, you are in the typhoon belt. So countries that the increase in temperatures increase the likelihood of extreme severe weather events with what we call, that is either floods or typhoons or tsunamis. So there is a direct link between the climate change and the likelihood of suffering such faster. So the Philippines is kind of one of the countries that is identified as a hotspot.
Oh, yes. And, Monica, there are climate change skeptics out there who do not see a direct link between climate change and diseases. Uh, for you, working as on climate change, uh, would you say there is a direct link between climate change and disease? And what is this direct link?
Okay. I think we need, the science is conclusive. There is climate change is real and it has an impact on the health of people. That's not questionable. What sometimes is very difficult is to find the direct link between individual events. So we cannot prove that that flood or that cholera outbreak or that malaria outbreak has a direct link with climate change. But we don't need to. We know that certain diseases like malaria or conditions like malnutrition, dengue, chikungunya, everything that is vector-related diseases, they have a direct link with weather conditions and climate in the long term. So by default, if you have a place that is warmer and hotter, the mosquitoes can breathe better. Therefore, you will have malaria. So climate change is just adding one more risk to health conditions. The WHO has already done estimated. The WHO is the agency that is overseeing international health, and they have said that there is an expected 250,000 extra deaths related to climate change. So I think at one point the discourse needs to change, and the science is already there. So there is an impact, direct impact. Probably you cannot prove in every single case, but we are seeing that the pattern or diseases are changing, and we are seeing malaria in areas where malaria was not before, and increasing malnutrition and diarrhea. And so, yeah, to the skeptics, I think that at one point they need to trust science.
Yes. Yeah, because there might be no direct link between the diseases you mentioned and of course malnutrition. But if they're connected to the weather, then this is a connection to climate change. So that is where the relationship or the link is. That's what we are looking at.
There is one very easy to understand sometimes that is a heat wave and a heat stroke. So when you have high temperatures, your body cannot cope with them. So and I don't know if you are aware that the very young and the very old and the people with chronic conditions are the most vulnerable to high temperatures. We have seen hot waves coming to us and deaths related to hot waves. So if climate change is increasing temperatures worldwide, we are going to keep on seeing all high temperatures and days. Therefore, we are seeing more and more people affected and either require hospitalization or even dying of heat stroke.
And cold wave and heat strokes, this would affect, as you said, the vulnerable sector, so young people and then older, what we call senior citizens here in the Philippines. And yeah. Monica, I don't know if you remember and as you mentioned that the Philippines is in the typhoon belt. And so in 2013, we experienced Super Typhoon Yolanda or Haiyan. And the MSF has been in the country since 1987. So what is your experience in dealing with the adverse effects on public health arising from this climate change in the Philippines or in other countries similarly situated where we experience now super typhoons and extreme changes in temperature?
Okay. I was not in the Philippines in the response of the cyclones, but MSF was very active. I mean, and was for more than a year. So also to highlight that the consequences of an extreme weather event, they are not quick. the devastation is quick, the recovery is slow. So we were doing primary health care, supporting hospitals, helping with shelter. My personal experience was in Mozambique. I was there responding to the Idai cyclone. And what we saw is that the first wave of devastation, that is the physical one, comes with consequences in the mid, short, mid, and long term. The people is displaced, areas are flooded, a part of the loss of lives and livelihood. You have increased risk of outbreak. So after that cyclone, we had a cholera outbreak in Mozambique, and the system collapses because they have to, even because the infrastructure is collapsing, like it happened in the Philippines, that physically the clinics were not there anymore, but also because you have to keep on going with the health needs of the population, adding a level of trauma where sometimes the system is not capable to cope. In the Philippines, for example, one of our angles of intervention that sometimes is oversight was the mental health needs of the people that was displaced. So you have lost either some people in your loved ones, you have lost your livelihood, your house, and you are impacted on that. So that's also an aspect of a natural disaster that we cannot forget, that the people is traumatized and need support.
Yes. Also, eventually, climate change or these super typhoons that would strain eventually the public health system. So more and more people suffer the long-term effects, for example, of cholera, and so they put a strain on hospitals and other public health providers. As an organization, what has SMF done to remain effective in preventing people in vulnerable communities from getting sick, or in saving lives without knowing that things will get worse before they get better? With that knowledge.
Yeah, I mean, we are reviewing the way we work to make sure that we put a green lens in the way we are addressing the emergencies we are responding to, and bringing in the population and the communities as part of the response to understand better how we can together cope with the consequences of disasters in general. Being climate change impact, being conflict, being epidemics that they are not directly linked with the climate emergency. So what we are trying to do is, for example, if we are talking about malaria, you can respond, you can treat, but also you can prevent, and you can add a component of vector control that will avoid that the malaria spread is quicker. So we are having an impact, an emphasis as well in preventive measures. So we do vaccinate, we do preventing campaigns for malaria with either seasonal prophylaxis or mass drug administration when it's needed. We do vector control. We monitor neglected tropical diseases that also raise when the system is not able to cope. We cannot forget chronic conditions, so we integrate chronic conditions as well, because we know that that chronic conditions are on the rise even on emergency settings. So we are trying to have an oversight and to address as much as we can, and at the same time starting thinking how and putting actions not to be part of the problem but the solution. So how we can respond better, being more environmentally friendly and conscious.
Yeah. And this being environmentally friendly, is this what you call the green lens in approaching diseases or solutions to diseases? And can you tell us more about the definition of green lens so our listeners and viewers can embrace the lens that you have in MSF?
So the green lens, or the planetary health lens that we see, is that you consider the situations you have in front of you. You see what are the factors that can influence in that situation, and you design the response or the potential response in the future, considering the rapidity or the speed you need to respond, because again, we are a medical organization, so our first goal is saving lives and avoiding morbidity. So while doing that, you can do it in different ways. So we are reinforcing, for example, national capacity for responding. We are considering sustainable supply chains, so how we can have the right resources, the right medicines in the right spot at the right time, but not trying to do that decreasing our carbon footprint, for example. So prepositioning stock, building up national procurement, same with human resources, training people on site to be able to respond quickly until we are we have to we launch a massive intervention. Again, knowing that we need to still have to move goods and materials and people in a quick way. But there is also local solutions that you can address. You can talk with the community to say, okay, how we can make the water cleaner together, no? How we can have access to latrines in a way that is not destroying the environment. So all these are the type of things that we are considering. How we can start merging, you know, our emergency action and medical by principle with other actions we can do, or how we can implement it in a way that is more environmentally responsible.
Yes, because a lot of people would think about the response and rapid response, which all there is in medicine or in emergency situation. But you're right. A green lens would give us, sustainability perspective. But I'm sure you've already heard about vaccine inequality. So in the Philippines, we have been in constant community quarantines for close to 2 years, and of course, especially here, developing country, one of our major issues would be vaccine inequality, and one of Philippines is included in the countries which was we could consider to be left out uh, in the distribution of vaccines. Some countries are already providing booster shots, while in the Philippines, there's still just debate, but still no plans for the importation or bringing in vaccines. So, given this situation, the pandemic and vaccine inequality, how do you see the pandemic playing out?
Well, in a pandemic, until everyone is protected, no one is protected. So we need to speed up the efforts for access to vaccination for everyone everywhere. In the beginning of the pandemic, we had a scarcity of vaccines. So, I mean, but now with the new technology, the manufacturing capacity is increasing. So we did a report shortly on transfer of a briefing note on how we can overcome the problems of vaccine accessibility, and one of the issues that we can target is technology transfer. The new platform for creating mRNA vaccine is not easy, but it's transferable. So including the current manufacturers, the capacity is increasing dramatically. So right now, I think they can produce 1.5 billion doses a month. So that means that by the end of this year, we may have 11 billion doses, that they are enough to cover the whole population. So we need to start finding ways that those vaccines are reaching everywhere where is not a vaccine available. And for that, it's the international solidarity, is high-income countries willing and moving and sharing the vaccines they have, is the international systems for intellectual property no blocking technology transfer and access to essential health products, and it's stepping up our common efforts to make sure that everyone has access to vaccine. However, that needs to come hand in hand with with a very strong fight and pushback towards the misinformation and disinformation. Even in places with low coverage vaccination coverage, some vaccines are going to waste because people don't believe in the vaccine or are not willing to get the vaccine. So in one hand, we need to make sure that vaccine is available, but now that we are seeing that that is not going anymore to be a barrier, we need to make sure that the people is willing to take the vaccine, is understanding how important it is for everyone to be vaccinated. We need to also make sure that that we are engaging with the communities, making sure that they understand that it's not, that it's really for all of us that we need to be vaccinated. So we need to train the staff. We need to make sure that it's not only the vaccine that is arriving to the countries, but the system to roll out the vaccine is there. So that you need the coaching, you need the trust of the population, you need the reception, the transportation. So there is many layers that we have to work on, and until that is not done, I am afraid that we are not going to see an end of the pandemic anytime.
Yeah, so it's likened to the balance between the demand and the supply side. So people should not hesitate to get vaccinated against COVID-19, but then still we talk only of supply of vaccines per se. But as you said, when human resource and logistical requirements should be met, and the demand and the supply side, then but would this also entail some negotiations with companies for like intellectual property rights and technology transfer? What do you think, Monica?
There are already a lot of conversations with companies, and not only with companies, but with the World Trade Organization. So I don't know if you're aware about the MSF Access campaign on the waiver. We can, in the middle of a pandemic, I think collectively we can find a way where we can ensure that people get the essential health products they need without jeopardizing innovation, that it's always what is coming back. No, if you waive, people will not invest and we will not have new products. We are in a massive pandemic. Everyone is affected. We can find ways of doing that, and we should find ways on doing that. So as I told you, we have to work in different levels. Intellectual property is a blockage that it needs to be seriously considered. Technology transfer is another one. But even if you have no patent, if there is no way that it can be produced elsewhere, then you will never get a solution. And then is the ability to scale up production. So you need a conversion of those things, and I think we are gaining a momentum, and I think there is possibilities on technology transfer. The WHO, for example, has done a technology transfer. It's supporting a technology transfer hub where companies that had developed the platform vaccine can actually share that knowledge, and you can build up new manufacturing capacity in countries where they were not before, in Africa or in Asia, and that can only help in the future to actually curb the pandemic. But not only, if we have that technology transfer in areas, we can use it for new pandemics coming up or new diseases that can come in a couple of years' time. So I'm optimistic. I think we can do it if we work together. But we need to keep the pressure. It's a political decision. It's not a medical decision. So we need to be very clear with our own politicians, starting from you in the Philippines, maybe, to actually making them that part of the solution as well.
Yes, thank you. It's really very political. And in the Philippines, there will be elections next year in May. So it's kind of complicated also. But yeah, we talked about technology transfer. And maybe to conclude the interview, um, what has MSF learned so far from what has happened? The pandemic has overwhelmed not all the healthcare infrastructure in many, many countries. And what do you think MSF, what does MSF suggest needs to be done to control the spread of the virus? And if successfully controlled, what steps should be taken to prepare healthcare systems for hopefully not but another pandemic?
What we have learned that is even in high-income countries where very performing health systems, this type of pandemic overwhelm. It's not only a matter of resources, it's a matter of preparedness and response. We have learned that in high-income countries, the outbreak response, it took us a little bit out of we were not expecting such a degree, and the health system was not able to cope with the consequences. In low-income countries and middle-income countries, where the response to outbreak is more integrated, we saw that when the number of cases were manageable, the response was actually, if I may say, was quite effective in a way, because they were applying experiences from outbreaks like large outbreaks like cholera or measles into another disease that was coming in. So I think one of the lessons learned from us as MSF is that that you need to invest in case management at clinic and hospital level and provide the better care you can. But if you do not engage with the community, and if you don't do a good outreach program, home-based care, you overwhelm the health system in the clinical side. And that has an impact not only in the morbidity and mortality for the pandemic cases themselves, but on all the rest health services that the health system needs to develop. What we have seen is, as usual, health providers are the most vulnerable when there is a disease, and we saw people getting sick. We learned that we need to be much more faster in identifying appropriate infection prevention control measures and put in place. The basics need to be in place if we want to be able to keep on working and not getting our staff sick. And we need to decentralize care. We need to engage the community if we want, in any outbreak or pandemic, to make it response effective and efficient. What we see in the future, how we think that that's a little bit beyond us to say how we can cut the pandemic. We are observing with interest, and we are contributing to the new pandemic treaty. But I said before, you can reinforce health system as we should. We should have enough staff trained and deployed. We should have enough structure everywhere. We should invest in surveillance system to identify threats. But if there is no political willingness and push for sharing, for trust, for really collectively responding to a pandemic, health system strengthening in isolation will not help. It will not be enough. So what we expect is that whatever we build in the future, and is being built in the future, there is an accountability system that forces governments and member states to actually play the game. We have seen in the international health regulations that we try, but there is not a clear mechanism to actually make people comply. So that's the thing that, and I'm hopeful. I mean, now there is a momentum, we have the time. So yeah, we keep the pressure, and probably we will have a good construct in the future.
Thank you very much, Dr. Monica Rull. We wish you and your organization well and the best in your endeavors. Ngayon, alam na natin ang epekto ng climate change sa ating buhay. Natin ang ng husto kung paano tayo makakatulong sa pagpigil na lumala pa ito. Huwag po kayong bibit. Makakasama po natin sa Wellness Tips ang isang eksperto na direktang tumutulong sa mga apektado ng disasters, dala man ito ng climate change o gawa ng tao. Wellness Tips, susunod na.